Welcome to today's episode, where we'll dive deep into the world of health economic evaluations. With healthcare costs on the rise globally, understanding the economics behind medical decisions is more crucial than ever. Today, we'll discuss the different methods used to evaluate the cost-effectiveness of healthcare interventions. So, let's start with the basics. What exactly is health economic evaluation?
Health economic evaluation is essentially comparing different healthcare options in terms of their costs and outcomes. The goal is to determine the most cost-effective way to allocate resources, especially in times of limited funding. There are several methods used in this process, including cost minimization, cost effectiveness, and cost utility analyses.
Right, and each method has its own strengths and weaknesses. For example, cost effectiveness analysis, CEA. DA is one of the most commonly used techniques. It evaluates the costs and clinical outcomes of interventions. But what are the main challenges with CEA?
One of the challenges of CEA is that it doesn't allow for comparisons between different types of diseases. Also, while it measures the costs of an intervention, it can't tell you what the opportunity cost is, meaning how much health might be lost if resources are shifted to another intervention.
And that's where something like the incremental cost-effectiveness ratio comes in, right? It helps quantify the additional cost of one intervention compared to the benefits it brings.
Exactly. The ICR provides a more detailed picture by comparing the incremental costs and effects. It helps policymakers decide whether the additional health benefits are worth the extra cost. For instance, if one intervention is slightly more effective but much more expensive, the ICR helps decide if it's still a good investment.
Now moving on to cost utility analysis, CUA, which brings in the concept of quality-adjusted life years, or QALYs. Can you explain how QALYs work and why they're important?
Sure. QALYs combine both the quantity and quality of life into a single measure. It's calculated by multiplying the number of years a person is expected to live with an intervention by a quality of life score for those years. This makes it easier to compare the effectiveness of interventions that affect different diseases or conditions.
So it's not just about how long a person lives, but how well they live during that time. And with QALYs, you can compare something like cancer treatment to heart disease treatment, even though they're totally different conditions.
That's right. The ability to compare across different diseases is a huge advantage of CUA. But, like all methods, it has limitations too. For instance, determining what the willingness to pay for a QALY is can vary from country to country.
That's a good point. The threshold for cost-effectiveness often differs based on national healthcare priorities and budgets. Which brings us to the question, should policymakers focus on the QLI or stick with more traditional clinical endpoints?
It depends. Some argue that QLIs should be the main metric, especially when the quality of life is a primary concern. However, others point out that using QALYs may neglect broader equity issues, especially for older populations or those with chronic conditions.
Interesting. And then there's cost-benefit analysis, which is the most comprehensive method, converting everything into monetary terms. But as you mentioned earlier, this is tricky because healthcare outcomes are hard to put a price on.
Definitely. It's the most thorough method in terms of economic theory, but it faces challenges, especially when it comes to converting health outcomes into dollar values. That's why contingent valuation methods, like asking people how much they would pay for certain health outcomes, are sometimes used.
Right. And decision modeling is another powerful tool for health economic evaluations. Can you explain the difference between decision tree analysis and Markov modeling?
Sure. Decision tree analysis is useful for evaluating simple, short-term decisions where outcomes happen in a single time period. Markov modeling, on the other hand, is better suited for chronic diseases, where patients cycle through different health states over time, and long-term effects matter.
That makes sense. Both models are used to predict outcomes, but Markov modeling allows for more dynamic and long-term scenarios, which is key for diseases that evolve over time.
Exactly. Whether you're analyzing the cost-effectiveness of a new treatment or evaluating long-term healthcare strategies, both methods provide invaluable insights into how resources can be allocated most efficiently.
So, to wrap up, understanding these economic evaluation methods can help healthcare providers and policymakers make more informed decisions, especially as global healthcare costs continue to climb. It's not just about saving money, but optimizing patient outcomes within a limited budget.
Well said. The more we understand how to measure the economic value of health interventions, the better we can ensure that every dollar spent improves public health as effectively as possible.
Absolutely. Thank you for sharing all these insights today. And for our listeners, we hope you've gained a better understanding of health economic evaluations. Stay tuned for more discussions on this topic in future episodes.
Thanks for having me.